Seven high blood pressure warning signs. Hypertension is a silent killer. Many people have high blood pressure but are completely unaware of it. It will be beneficial to be aware of some of the warning signs of high blood pressure so that you can seek treatment as soon as possible before any harm is done. Hypertension is another term for high blood pressure. Blood pressure is the force exerted by blood as it flows through a blood vessel. High blood pressure is a condition in which the force of blood flowing through the blood vessels is constantly high. High blood pressure is a dangerous condition that can harm the heart by forcing it to work harder to pump blood to all parts of the body. It can also cause artery hardening, which can lead to stroke. Every year, high blood pressure kills more than 7 million people. It also accounts for approximately 4.5% of the global disease burden. High blood pressure can be passed down through families. Its development can also be influenced by age and race. According to one study, hypertension affects older people disproportionately, and the majority of them die from non-communicable diseases such as hypertension, diabetes, and heart disease. The fact that hypertension is not always visible or felt makes it even more dangerous. You may have high blood pressure and be unaware of it. According to the CDC, approximately 1 in every 5 adults with hypertension is unaware of their condition. This video defines high blood pressure, discusses warning signs of high blood pressure, and explains how to naturally lower high blood pressure. Chart of blood pressure ranges. If your systolic blood pressure is less than 120 and your diastolic blood pressure is less than 80, 120/80 mmHg, your blood pressure is considered normal. According to the American Heart Association, there are 5 blood pressure levels: normal, elevated, hypertensive stage 1, hypertensive stage 2, and hypertensive crisis. High blood pressure warning signs. While hypertension is more common in adults, it can also affect children. This is why it is critical to monitor your blood pressure levels on a regular basis. Constantly monitoring your blood pressure will help you avoid medical emergencies and live a healthier lifestyle. The following are some common blood pressure warning signs to be on the lookout for. 1. Dizziness. One of the most common symptoms of long-term high blood pressure is dizziness and loss of coordination or balance. In hypertensive people, dizziness is usually a sign of a stroke. A stroke occurs when the brain's blood supply is cut off. Dizziness can occur as a side effect of hypertension medications. 2. Breathing difficulty. People suffering from pulmonary hypertension may feel short of breath and have difficulty going about their daily activities. Pulmonary hypertension is a form of high blood pressure that affects the arteries in the lungs and the heart. Prolonged high blood pressure can cause fatigue and shortness of breath. However, sudden shortness of breath can be a sign of more serious health complications, such as a heart attack or stroke. 3. Flushing of the face. When blood vessels on the face dilate, this causes facial flushing. Cold weather, sun exposure, hot drinks and spicy foods, and some skincare products can all cause facial flushing. Additionally, blood pressure-raising factors such as alcohol consumption, emotional stress, and exercise, which temporarily raise blood pressure, can cause facial flushing. It is important to note that while facial flushing can occur as a result of hypertension, it is not the cause of facial flushing. 4. Blood flakes in the eyes. This is yet another high blood pressure warning sign that should not be ignored. Blood spots appear in the form of red spots in the eye. Subconjunctival hemorrhages are another name for these red spots. A subconjunctival hemorrhage occurs when tiny blood vessels beneath the conjunctiva rupture, trapping blood. Subconjunctival hemorrhage occurs in hypertension when too much pressure on the tiny arterial walls stretches the tissues, causing them to damage and break. If left untreated, the arteries and optical nerves of the eyes may be damaged. 5. Vomiting. You may vomit if you have high blood pressure. During hypertensive crisis, vomiting is more common. A hypertensive crisis is characterized by dangerously high blood pressure that necessitates immediate medical attention. Other signs of a hypertensive crisis include nosebleeds, confusion, and blurred vision. 6. Nervousness. Anxiety is one of the subtle warning signs of high blood pressure. Anxiety is not a normal emotion. It is a disorder in the same way that depression is. Unfortunately, high blood pressure can also lead to anxiety. Sweating, shortness of breath, heavy breathing, and trembling are all symptoms of severe anxiety. If you are experiencing these symptoms, you should consult a doctor for a proper diagnosis. Anxiety, in and of itself, can cause a rise in blood pressure, thus, it must be treated. 7. Nasal bleed. One of the warning signs of extremely high blood pressure is nosebleed. Elevated or stage 1 hypertension does not cause nosebleeds. However, it is possible in the event of a hypertensive crisis. Other signs of high blood pressure to be aware of include fatigue, confusion, blood in the urine, and difficulty sleeping. How to naturally lower high blood pressure? One way to lower your blood pressure is to take antihypertensive medication, but not everyone enjoys taking drugs all the time. There are non-medication methods for controlling or lowering blood pressure, such as regular exercise. Reduce your caffeine consumption. Stress can be managed or reduced. Reduce your sodium intake, don't eat too much salt, and drink less alcohol. Reduce your weight, reduce your intake of added sugar and refined foods. Stop smoking, deep breathing and yoga should be practiced. Get enough rest, consume calcium-rich foods. Consume natural supplements such as garlic extract and whey protein. To lower blood pressure, consume zobo drinks. It should be noted that these natural methods of lowering blood pressure do not have to be used in place of medications. They are simply methods of health management. If you have been diagnosed with hypertension, consult your doctor first to determine whether it is safe to discontinue medication. Your blood pressure range will determine whether or not you will take antihypertensive medications.